What is an ear infection?
Ear infections often affect the middle ear, the space behind your eardrum. They happen when bacteria or viruses enter this area, usually after a cold or respiratory illness. The infection causes swelling and fluid buildup, leading to symptoms like pain, muffled hearing, and sometimes fever. Understanding how ear infections develop can help with prevention and treatment.
Step 1. How germs reach the middle ear.
Most ear infections start with a problem in the upper respiratory tract, like a cold. Germs, bacteria, or viruses travel from the nose or throat through the eustachian tube. This small passage connects the middle ear to the back of the throat, normally helping drain fluid. When inflamed or blocked, it allows germs to reach the middle ear.
Step 2. Inflammation and fluid buildup.
Once germs enter the middle ear, the body's immune system responds. Blood vessels in the ear lining swell, causing redness and inflammation. The eustachian tube can become blocked, trapping fluid that would normally drain. This buildup of fluid creates pressure and provides a perfect environment for germs to multiply.
Step 3. Pain and pressure develop.
As fluid collects in the middle ear, pressure increases behind the eardrum. This pressure causes pain, especially when swallowing, chewing, or lying down. The eardrum may bulge outward and lose its ability to vibrate properly, causing muffled hearing or popping sensations. In severe cases, the eardrum may rupture to release the trapped fluid.
Step 4. Recovery or complications.
The body usually clears the infection as the immune system fights off germs and the eustachian tube opens up again, allowing fluid to drain. Symptoms improve as swelling goes down. However, if fluid remains or the infection becomes severe, complications like hearing loss, persistent pain, or a chronic ear infection can occur, making medical attention important.